Now, someone who knows what it's like to live in isolation is Canadian astronaut David Saint-Jacques. The last time the National spoke to him, things looked a lot different.
We don't feel lonely. I just wish I could hug my kids from time to time.
Back then, we had been following his journey to space from the start.
All these training sessions, they represent things that I must know and I must master if I want to survive.
Now, Saint-Jacques is embarking on a whole different kind of training, trading in his spacesuit for scrubs and still learning, this time on the front lines in a COVID unit at the McGill University Health Centre. And joining us now, Dr. David Saint-Jacques in Montreal. Dr. Saint-Jacques, boy, what a difference a couple of years makes since the last time we chatted. Two questions. How are you, and why go back to practicing medicine?
Hi, Andrew. Yeah, indeed. What things have changed, eh? What a state this planet is that I came back to. Come back to medicine for me. You know, I was a physician before working, before becoming recruited for the astronaut program, and I'd always wondered whether it was possible to go back to clinical practice after 10 years. Basically, that's when I moved to Houston for, full-time training. And the pandemic has kind of prompted me to. I just wanted to do something useful, and I asked the Collège des médecins du Québec, who are the authority here for physicians, and the universities. And yeah, there is a way for an old rusty physician to get recertified in a university setting. And there we are. I'm not the only one. So, it's my second week now. It's a steep hill to climb, but I kind of sleep better now that I feel like I'm doing a kind of a, tangible contribution.
I mean, can I ask you what that process has been like? Because you are in the process of the training. So what's it like being back in a hospital setting, particularly in the context of a pandemic?
Yeah, so as most hospitals have they kind of assemble all the COVID patients together on one unit to kind of protect the rest of the hospital. And same thing with the staff, physicians, nurses, everybody kind of stayed on the COVID side or the non-COVID side. So I'm on those so-called hot COVID units where there's very varied teams. People kind of volunteer to join those units. So we get physicians and nurses from all other specialties that kind of pitch in for a day, an evening, a week, whatever they can afford to do. So it's a really kind of a multidisciplinary kind of teamwork attitude.
It occurred to me when I'm thinking about what it must say about the state of the world, the state of the country right now, that you felt the need to do this, right? I mean, these are pretty exceptional steps that you've taken to get involved once again. What does that say about where we're at in this pandemic?
I mean, I think it's the big fight going on. This is the battle of at least the year and maybe several years. Everybody, I think, feels the need to do something. And so there's many ways that you can help, be it only to help your neighbor who's a nurse, shoveling the snow from her cars. It can be simple things like that. I feel like, we say it in French, aider fait du bien. When you help, you feel better about it. And I think it's part of it. You all have to do our part.
One last question for you. What is it that I don't know, that you've seen on the ground that you think would benefit Canadians to have a better appreciation of, either of the effects of COVID or the people who are helping to try to make it better?
So there's one thing that kind of has been a bit of a wake-up call for me. I think, like a lot of people, I tended to see COVID as either a very benign infection, you test positive or you don't really have any symptoms, or we also hear about the people whom for COVID as a catastrophe and they end up dying of it in intensive care, intubated. But there's not between these two extremes, there's a lot of people. There's thousands of people whom for COVID is just extremely traumatic. They go through hell in hospital and they will recover, but it's terrible with bad, huge impact on their families. I was a bit startled when I admitted under my care a guy about my age with no particularly bad disease beforehand and literally good shape. But for him, COVID was like a disaster. And it has, I think that's something that we tend to forget. We just see numbers. But each one of those thousands of people we hear about who are hospitalized, it's a disaster. It's just a human catastrophe.
Well, Dr. Saint-Jacques, I always appreciate tapping into your expertise, but also your insights. So thank you for making the time for us today. I really appreciate that.